We're back at the line table for our final topic. A vote in the Senate on health care legislation was pushed back earlier this week. Republicans are seeking to repeal and replace the Affordable Care Act. There's a lot of talk about this one, and we continue to follow how it might affect New Mexico. What I want to hear from you all today is, what do you think is at stake for New Mexico in this national debate? Let me start with you, Dee Dee, on this one. Of all the pieces here, let's start with Medicaid. What happens to New Mexico if Medicaid takes a cut here? And are we more vulnerable than other states? If so, how vulnerable are we if we lose Medicaid?
Yes, we're very vulnerable. The Kaiser Family Foundation said New Mexico was one of the 11 states that would be affected most by the BICRA, I guess they're calling it now, and that's because of the 220,000 people who gained coverage as a result of the Medicaid expansion.
Right.
Those folks will no longer be able to access health care, and there has been a huge ramp up in the state's economy to serve the new Medicaid population. I think the estimate is that New Mexico would lose 32,000 jobs if the bill goes through, and would suffer, I don't know how many millions of dollars. I think they said 2.3 billion in federal funds would be lost in New Mexico. And that's because of the Medicaid program. That doesn't even count the people that receive insurance through the exchange, who may not have subsidies to buy insurance. And it also doesn't count the big impact on the state budget, which would then have to pick up any kind, if they chose, to pick up any kind of federal cut in the Medicaid program. And they're talking about capping the Medicaid program after a certain number of years. So they're talking about giving the states more flexibility. Well, that is under a cap. And the flexibility that they're actually talking about is the flexibility to cut benefits and to reduce eligibility. So there would be, and that's really, or to reduce reimbursements for Medicaid. And that's a big problem for healthcare providers in New Mexico. The Medicaid reimbursement rate is already very low, and rural providers, especially, who depend upon it, would be devastated.
I could imagine, Dan, the legislature, this is in motion, a lot of things, a lot of pieces still working here. They're going to take this July 4th break, talk to constituents, go back at it after they get back. But for New Mexico, again, I ask, where do we come out in this? I mean, can we pick up, if what Dee Dee's saying, if we get to a point where it's up to us to provide what we can provide given our budget, what happens?
So in the disclaimer category, I do insurance for a living, so I think there's it's a win and a lose situation for us. We have become so dependent on Medicaid dollars, and we keep expanding the Medicaid program, that anytime there's any movement in the Medicaid dollars to get less to New Mexico, it's devastating. And it's been an argument I've had for years to say we got to stop pushing people on the rolls of Medicaid and expanding the rolls of Medicaid and figure out how to get insurance affordable. What we do know is that under the Affordable Care Act, insurance became not affordable. The cost went up tremendously. We know that the carriers have left the markets. We know that the plans people were getting put on were not very good plans. So we kind of had this feel-good deal. It's interesting that finally folks in Washington are actually reading the bill before they vote for it this time, which is a change from the last time. But what we're hearing out of this bill as a Republican is that it's a push towards making that insurance more affordable. It's a push to getting people in that private market, because no matter what we've done under the Affordable Care Act, one of the reasons why the cost of insurance has gone so high has been the constant constriction of the market. When you go from 8 carriers to 5 carriers to 3 carriers, your price keeps increasing. The price keeps increasing, the payouts to doctors keep decreasing, because they're able to tell doctors, either do business with us or you got no other options. So I think that the Affordable Care Act, this healthcare bill. I think at some point we got to take our partisan hats off and have a real conversation about healthcare in general in New Mexico and across the country. And I say that as a Republican. I mean, I was the first person to introduce the health insurance exchange bill in New Mexico. Massachusetts passed one. I introduced it and couldn't even get a Democrat to listen to me.
Right.
I mean, I was vilified. And then all of a sudden, when President Obama came out with it, it was, you know, the second coming of the Bible. And so we didn't have the same policies. There's a lot of differences. But I think at the end of the day, at some point, we have to start figuring out a way to move past the polarization of this healthcare deal. We have to have a good, honest debate about the cost of care. We have to have a good, honest debate about the cost of drugs. We have to have a good, honest debate about litigation. And then at some point, we got to figure out how we're going to get people to pay their share.
That's a good point. Pick up on that if you would. Is that possible that we can get to what Dan just mentioned? Is there bipartisan possibilities here to make these things happen in the near future?
I think there has to be. I mean, I think it was a bipartisan effort to a certain extent to have a bill like the Affordable Care Act in the first place come out. You have to compromise. If you don't, then you don't get something out. And I think that's the problem with the approach that the Senate leadership has taken here. Mitch McConnell, had such a tight grip over what was being drafted to the point that his own members had no idea until the day before they were expected to vote on this thing, many of them. You can't craft legislation, whether you're talking about the replace or repeal of Obamacare, or you're talking about the state budget in Santa Fe. Right. You can't do it with one or two people and then expect to come out of that room and have a majority approve what you're doing. I mean, it just isn't done that way.
That's right. Tom, the delegation's been pretty consistent on this, that it's just going to be a disaster for New Mexico. What your sense of this whole thing? Are we possibly going to come out of this with something good for us?
Well, in the long term, yeah. Short term, it still has yet to be seen. Here's what I mean by that, is that you have the ACA, which was put into force in effect. You'll have the Republican version, whatever that is. I don't think it'll be a bipartisan effort. And then version 3 is where I think you'll see that middle ground, and that will probably happen in either 4 or 8 years, based on what your feeling is on the presidency and the Congress.
Right.
However, insurance companies, they manage risk. They don't take it. And the legislation that's coming out right now is just all focused on insurance companies taking that risk. And Dr. Martin Hickey, who runs New Mexico Health Connections, is a board member for the New Mexico Health Insurance Exchange, gave a very informative and entertaining presentation to the Economic Forum, where he really kind of broke down what was wrong with the ACA, where this BCRA comes down, and how to fix it. But in the short term, some of the things that he mentioned is that there will be lower premiums, but there will be higher out-of-pocket costs when you go to visit the doctor. And that's really going to come back to hurt people in the pocketbooks. And that's where I think we're going to see the potential impacts in New Mexico, is when people start to pay these out-of-pocket costs, even though they have very low affordable premiums. The cost to visit the doctor is going to be through the roof. And that's going to increase debt, and that's going to decrease people's ability to spend money and or just go into bankruptcy as a result.
That's a good point. We'll pick this up. Sorry, Didi, we're just out of time. We'll pick this up after the Congress gets back after the break, and we'll see what happens for New Mexico there. Thank you all for watching. Thanks for being here.